It's just connecting. One second. Okay, perfect. Okay, perfect. So we are live. Good afternoon, Dr. Ashu. Thank you so much for being here. I'm actually very excited about this conversation. Um, yeah, I think this is going to be really good. Um, you know, for anyone who may not have met me before, anyone who may not know me, my name is Larissa Assam. I'm a board certified family medicine physician, and I have expertise in women's health and in helping people reverse chronic diseases. I do a lot of work with pregnant women, postpartum women, and I also do work helping people reverse conditions like high blood pressure, diabetes, etc. So, today isn't about me. It's actually about Dr. Ashu, who's our guest speaker. And so I'm actually going to turn it over to you, please, Dr. Ashu. If you could just tell us who you are for anyone who maybe has not met you before.
Hi, everyone. Thanks, Larissa. It's so great to be here. So I'm Dr. Agbor Ashu, medical doctor and digital health specialist. I just finished with my master's in health informatics from the University College London. And prior to going to do my master's for the last decade, I've been working in digital health with a startup called Gifted Mom, where we were involved in democratizing access to care for pregnant women and nursing mothers. And after which, also co-founded a solution called Healthlane, which is similar to what Dr. Larissa is doing, which was basically using diagnostic services to get better information in order to help people prevent chronic conditions and help people reverse these conditions. I currently run a digital diagnostic service in Cameroon, known as Beacon Pasteur, where we are helping to provide affordable, accessible, and quality diagnostic services to the population within Douala. Very passionate about using digital technologies to improve access to care for the general population and also improve in health systems strengthening. So I'm very happy to be here to participate in this conversation today. Thank you.
Amazing track record. And I think, it's been a couple of years now, but one of the things that stood out to me from way back when was, I think, the work you were doing with Gifted Mom. So it's so incredible to see how that has progressed and transitioned over time. So we're not just going to leave it at an introduction because you've done so much and said so much in a very short time. I have some people who are tuning in who are also colleagues, other physicians, and also some people who are aspiring doctors as well. So before we get into the conversation on maternal health and digital transformation, why did you even want to become a doctor in the first place? Let's start there. And then, yeah, let's start with that question and then I'll ask my next one.
Yeah, so um, when I look back, I don't think there was any particular inspiration as to why I wanted to become a medical doctor. I know some people probably received visions,
Mm,
others were passionate about something. But the things that I do remember, I mean, my mom told me that once I grew up was that I kept telling her when I was young that I was either going to be a doctor or a pastor.
mm,
And I remember that in nursery school, I acted the part of a medical doctor
mm,
uh, um, um, during a play in school. Primary school, I was part of the Red Cross. I don't know how I found myself there, but I was part of the Red Cross. And
mhm,
then back in secondary school, of course, I got very interested in the sciences. And I told myself that it's going to be most likely I'm going to be doing medicine, probably, or accounting. And I mean, in those days, there was the competitive entrance examination into the Faculty of Medicine in Yaoundé, and then also the University of Boya had just opened up this medical school. So I
mm,
guess that's my journey to how I became a medical doctor. Nothing particularly inspirational. And I think just being there, that's where I began to find my calling as to what I was called to do.
Okay, amazing. And so you started off, decided you were going to become a medical doctor. And then specifically, why digital health? Why did you even decide, even most recently to do the master's in health informatics? Because some people may not have heard of it ever.
Yeah. So when I left medical school, I did practice, I think, for about a year.
Mm-hmm.
And that was when I got to meet a friend who had started with the idea of gifted mom. And at the start, I mean, it's digital health. And at the start, I wanted to basically just begin with a consultancy position there and just helping to gain access to like the Ministry of Public Health and also respond to the queries of pregnant women. And 1 month in, I found myself being involved because one of the things is that I don't like to do work partially. So when I'm I'm really fully dedicated to that. And when I started doing all of that, then I started finding interest and learning a lot about what digital health is. And that is what caused me to be very invested in digital health. And that was at a time when it wasn't very pronounced in Cameroon, in Africa as a whole. And that's exactly 10 years down the line after I had been in that space, I decided to then strengthen the skills because a lot of the work that I did in digital health was based on experience, learning online and applying. And then after that, um, uh, that's what inspired me to go do a master in health informatics, which is basically how do we use data to make better informed decisions in order to improve service delivery, in order to strengthen health systems. That's what health informatics is all about. So just being at the intersection of technology and healthcare. And that's why I decided to do the master's in health informatics. Yeah.
Okay, absolutely amazing. Thank you. And I think that background is excellent and honestly highly inspirational. This is why I think you were the perfect person for this conversation, and you are the one who actually came to mind, because one of the realities, we live in a tech enabled world today, and there is so much value I believe we can offer to patients, to healthcare systems through technology. And so with that, I do want us to get into our discussion for the day. And thank God for your experience, because I think you have so much to pull from that, from the masters, from Gifted Mom, Healthlane, as we have this conversation today. So let's start at a high level, at the policy level, governance level. We're thinking ministries of health, international players, WHO, the UN, etc. At Brophy, we have a clear mission, knowing that there's a statistic by the WHO that says 80% of maternal deaths are actually preventable. 80. And so that's a huge percentage. And our mission is very clear. We believe in a world in which there are zero preventable maternal deaths worldwide. And so, based on your experience, how can governments and international health players integrate technology, for example, dashboards, but anything else that comes to mind, and real time data systems in order to improve progress and accountability towards reducing maternal health deaths?
Thanks, Larissa. So I think there are several pillars that governments need to take into consideration. And it starts from like foundational things and then moves up into the different use cases, particularly in healthcare. Because, like someone said, it's not data that saves life. It's not technology that saves lives. They are the people that save lives. So technology is just an enabler. So I think that one of the first starting points for governments, international bodies, is to identify what are the existing gaps in maternal health, because a lot of it has to start by defining where the problem is. It has to start by identifying what are the challenges that we are facing in maternal health care. Once governments, once international bodies are able to define that, and it begins from, at all levels, whether at policy level or it's at the implementation level or it's at the rural level, we need to ask ourselves the question, what are the current gaps? What are the existing challenges in maternal health care? Like you mentioned, if 80% of maternal deaths are preventable, so why are women still dying? And then the next question is, looking at the current challenges, we need to ask ourselves the question, can these be solved using technology? Because there is a lot of buzz around use of technology now, where people are, for example, having the solution and looking for a problem to solve, rather than, so they're moving from solution to problem instead of moving from the problem to the solution. So the difference is that people are trying to force a solution on top of something. Meanwhile, it requires a different kind of solution, which is not tech related, right? So you're trying to solve the problem, probably, let's say, for example, expertise in human resource. You're trying to force that by, implementing a technology or something that it's going to help people, improve data or something. Meanwhile, you just need to employ an additional person that is going to bridge that gap, right? So the questions we need to ask ourselves, the next question is, can this problem be solved using digital technologies? And if the answer is yes, the next thing governments need to evaluate is, what are the resources necessary to set this up? And this is not just about trying to do lots of pilot, because in healthcare, particularly in Africa, there are lots of pilot projects when it comes to digital health. So they start a project, run it for 2 years, 3 years, and after that, it is abandoned. So the question needs to be, what are the resources necessary to set this up? And this is not just about setting it up, but in terms of what is the long-term sustainability plan for these to actually work, for technology to actually work. And that brings me to the point where we need to consider some of the World Bank Group has a framework for digital development, which could be a very important framework that governments particularly can use in order to develop these kind of solutions that can help prevent maternal death. And there are 3 pillars. The first thing we need to consider is, what are the digital foundations? And digital foundations are a very simple thing. Technology can only work where there is connectivity. And so the government is to ask themselves, are people connected? Especially if the majority of maternal deaths are taking place in rural communities. Do they have access to internet if we are going to solve it using digital technologies? So connectivity, access, and use is absolutely important. That's the first part. The next thing is digital data infrastructure. If you need to implement an artificial intelligence, you need data, you need infrastructure in order to be able to implement that. You need data centers. All of these need to be set up at the foundational levels. And again, like you mentioned, if this is policy level, then all of these is not just coming from the Ministry of Health, for example. It has to do with those that are responsible for, communication, those that are responsible for digital innovations, or what have you. It has to do with the head of government, putting all of these together. So it has to be some level of collaboration. So that's the first level in terms of digital foundations. The second level is based on the World Bank Group Digital Development Framework, are digital accelerators. What are the digital safeguards? If we need to start using people's data, having access to real-time data, do we have cybersecurity measures that are put in place? Do we have measures in which people's data are being protected? Those safeguards need to be put in place. We have things like digital public infrastructure, digital identity, for example, which is easy if you implement, for example, for every child that is born or for every woman has a digital identification, and it can be traced along the pathway when a woman has a problem and all the like. And the next thing under digital accelerators are the digital capabilities. If we need to implement digital technologies, are the healthcare professionals who are supposed to use it having the skills in order to be able to use the technologies? It's only then and then that we move to the third level of the framework, which is the digital use case. And that is actually the solution that we are implementing with respect to how to prevent maternal and infant death. So if it is at the level of data use that is a problem, then we implement a solution at that level. If it is that there is need for a telemedicine solution, then you implement that solution. But all of these foundations and safeguards and accelerators need to be in place for technology to thrive in such a setting.
Okay, that is so comprehensive. That was excellent. And I really love your approach because it's very pragmatic. You know, sometimes we can have conversations about this, and frankly, this is your area of expertise. And you can say technology is the end all be all, and that's it. But I really love your approach because, of course, there's a lot of value in it. But I like your approach because, as you said, sometimes it is the answer. It could be helpful, but not necessarily in every single situation. So let's even make it more practical and let's talk about your specific use case with Gifted Mom. What did you observe during that time? Talking about all of these foundations, you know, is that the process you took when you were implementing, or is this even a lesson for us to learn now? Like you learned along the way, wow, we didn't have certain foundations in place and that impacted the work that we were able to do. So please tell us.
Yeah. So at Gifted Mom, one of the things that we identified that was a problem was that women never had access to information. Women were missing their appointments in the hospital. According to the WHO recommendation at the time, I think that was back in 2015, women need to do at least 4 antenatal care consultations. But the first antenatal care was about 98%, and then the coverage decreased to like 40, 60%. And those are some of the reasons why those are some of the reasons that contributed to some of the maternal death. So the question was, how could we bridge that gap, especially in the absence of, women go to the hospital, let's say every month, but between the period when they have their next appointment, a lot of things could happen in between that period. So the question was, how could we be that bridge out of the hospital when women are out of the hospital? And that's what we then decided what's the best solution to create at this time? Because it's a problem for rural communities, it's a problem at the level of urban communities. So our approach was, yes, technology could solve that. And so we developed an automated SMS and voice messaging platform that did 3 things. The first thing was that it sent reminders to pregnant women and nursing mothers about their next appointment at the level of the hospital, ensuring that we improved the total antenatal care in hospitals. And because we understood that the foundations were not there in every setting, women never had access to internet, women were not using internet, our approach was based on SMS. Everyone could access SMS using feature phones and smartphones as well. So the first thing was send reminders. Second solution was provide health education for these women. When you see a warning sign, what should you do? And it was stage-based on the pregnancy, based on the age of the pregnancy of the woman. And the third part basically was focused on giving the women access to ask questions and get responses from medical doctors. And all of this was through SMS. And it was a short code number which was free of charge. So now, in our case, we understood that we couldn't take part of the infrastructure aspect. And because it was directed at the consumer, we had to adapt our solution based on the consumer needs. And that's why our approach was to use the SMS and the voice messages. Sometimes we did send voice messages to women, pre-recorded voice messages, which was translated even in the local languages so that women could better understand and respond to the messages. So this is how we were able to implement this use case for Gifted Mom.
Okay, amazing. Thank you for that overview. So, as you implemented these things, the SMS appointment reminders, the health education based on gestational age, and the discourse with physicians, the Q&A, what did you find that worked and maybe did not work as well? Oh, sorry, you're muted.
So I guess when you're a startup, there are certain things that you don't have full control over. We did had a memorandum of understanding with the minister or the Ministry of Public Health to access different health facilities and institutions where we collected the data of those women in order to be able to send these reminders and health education to them. So a few of the lessons that we learned along the line was, the first one was the importance of user-centered design in order to be able to help solve people's problem. So that's why our solution was designed such that it could work offline and it could work on any kind of phone. The second lesson learned along this journey was the importance of also looking at, that was not the only problem women faced, because many a times women went to the hospital after being reminded, but the time spent, the wait time in the hospital was a huge problem. So we couldn't solve that, but one of the lessons learned was that there is the need for like an ecosystem that provides solution around women's health. One person could be solving the problem of wait time, another could be solving the problem of health education, but trying to solve it all may be so burdened, overwhelming for one particular startup to be able to do that. The third aspect was really like the aspect of funding and sustainability, because we're not for profit, so it was highly dependent on grants in terms of implementation. And so for digital technologies to thrive and not end just at the level of pilot projects or just reaching, say, 6 or 5 regions in a particular country, it's good if the government has a way of sustaining that, of partnering, of co-creating alongside the startups for solutions that actually work. So this may not just be in terms of providing the funding, but also be in terms of providing what are the enabling environment for these startups to be able to thrive. Those were like some of the key lessons that and challenges that I learned while implementing or while being in the digital health space.
No, that's very practical. Thank you. Yeah, makes sense. I completely agree. And so I'm just curious, what is the current state of Gifted Mom now? I know this was back a couple of over 10 years now, which is crazy to think, but what's happening with it now? What did you guys decide?
Yeah, so we had a transition. At the moment, the technology still exists. We've been able to implement a couple of projects right up until 2023. The biggest being Gavi and MasterCard back in in Mauritania for a 3-year project that we did run. And I
Yes.
mean, we proud to say that we reached over 500,000 women across
Wow.
four different countries
Wow.
using our solution. But at the moment, there is like a transition in what's the next big thing
Mm-hmm.
in terms of how can we better strengthen the health system? How can we
Mm-hmm.
better incorporate with government in order
Mm-hmm.
to be able to use digital technologies to improve access to care for pregnant women and for nursing mothers? So I think that's the next stage of what we are envisioning in terms of contributing, particularly here in Cameroon and the countries where we've worked in.
Okay, that is amazing impact. Over 500,000 women impacted in over 5 countries. And these were sub-Saharan African countries, would you say, for the
Yeah.
most part? Wow. Wow, wow, wow. 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 I'm actually really impressed. That's good. I mean, I look forward to what the next season will bring, what the development will come. And I think that's the reality of having a startup. Sometimes you go back to the drawing board, you take the lessons, and then you re-innovate, so to speak, or
Yeah.
reinvent, I should say. So that is incredible. Um, I'm curious to know, let's talk about the next pillar, clinical safety, birth as well. Based on your experience during that time, hands on, you guys were speaking with the mothers and everything. Did you find that there were any women who were actually delivering outside of the hospital? Because certainly you can go to like a clinic, a hospital to deliver, but were any births ever happening at home? Like maybe some people didn't make it there in time. And how did you find that the tech tool, right, with Gifted Mom, how did you find that it was able to help at all, if anything?
Yeah. So there were definitely in some rural areas where women were actually giving birth at home. So we have like traditional birth attendants that were responsible for these women giving birth in different or at home or in their different structures. And that's really based on some of the cultures of the people where if you like, for example, it's only a woman that has to help deliver another woman. And so the hospital facility wasn't a very convenient one. So there is a cultural aspect that determines that. There's also the financial aspect where women don't have the means to be able to deliver at the level of the healthcare facility. And so they may find themselves going to areas or to places where they just deliver at home. Of course, at the time, we didn't have a particular solution that was really directed at that. But I remember that we worked on a project in the far north region of Cameroon alongside the United Nations Population Fund, UNFPA. And it was how do we strengthen community health workers to drive more women to deliver at the level of the health facilities. And I remember the community health workers were empowered like with smartphones, where they went to the communities, registered women, encouraged them to go to the hospital. And then there was at the level of the dashboard of the community health workers, they had the different women, the names of the different women in their neighborhood. And when it was the time for their next appointment, they were responsible to go meet those women and remind them that they have to go to the hospital for the appointment. Also, within that project, there were drivers that were empowered and given tricycles that could help transport women from one place to another in case a woman was in labor. So they could access enclaved areas. So one of the ways that was empowered using technology was these drivers had smartphones that we gave to them. And in addition to that, so when there was a case that the community health workers signaled, Then we had to inform these drivers of the tricycle, and then they go carry the women and bring them at the level of the health facility. So those were like a few solutions that we tried, that we piloted in the extreme north region of Cameroon. And I mean, we realized that it did avert some complications and some dirt, transporting some of these women to the health facilities. And of course, it was free of charge at the moment. But again, it didn't entirely solve the problem of home deliveries versus hospital-based deliveries. It didn't solve the problem of if deliveries are taking place at home, how do we ensure that it is safe? How do we ensure that it's in a sterile environment? But it just solved one aspect of it, which I feel that if it was replicated, could definitely cause, could definitely avert certain deaths and definitely improve maybe the amount of deliveries that take place at the level of the hospital, which could be as a result of barriers due to access. So having those tricycles, having the community health workers, those were one of the models that we use in order to be able to help women deliver at the level of the health facility.
Okay, amazing. And, let's not just limit it to Cameroon, actually, or even Sub-Saharan Africa, because you've spent ample time now in the UK. So I'm curious to know, I know, like me, you probably have a research mind and you've probably been looking into policies and systems in place in the UK. I'm just curious, what are some observations that you've made in the UK thus far concerning how maybe they're leveraging technology, if any, in helping with maternal health? Like some different, clearly they're very different terrains, different demographics, but just curious.
Yeah, so at the level of the UK's health system is far more developed than some of the systems in Africa. They do have some of their challenges also, which I must admit. How sometimes it was difficult to access a specialist. Sometimes the wait time at the level of the health facility was really enormous. But when you compare that to what we currently have in Africa, I think they are more advanced than what we have. And I think one of the things that has stood out in the UK health system compared to African health system is the national health services, the NHS, that has a system of insurance for for majority of its citizens. So a government insured system. So what that basically means is because people are insured, they can have access to the hospital at any time, right? So a woman in Cameroon or in Africa is competing for basic needs and hospital. And so they are trying to choose between what should I eat, trying to choose between the education of their child versus actually going to the hospital. So that's what makes the difference, because they don't have that insurance coverage. So women who are in the UK will have access to healthcare services because they are insured, versus those in Africa who have that competing interest over competing priorities in terms of how do I access the healthcare services. The second aspect, when we are looking at it, maybe in terms of birth at home and hospital-based birth, is really access to the ambulance services. Now, I gave you the example of how we're trying to implement a tricycle service, which at the moment was not very medical. But in the UK, in case a woman is bleeding now, for example, you have ways in which you can be able to access the ambulance services. So you either call the number, and then you have the ambulance service being deployed and you're being carried to the hospital and taken care of. Or you have like the NHS app where they've incorporated artificial intelligence and you can ask questions or there is like a chatbot where they ask questions and you respond to the questions, and based on that, they evaluate whether it's an emergency or not. And they can point you like to the nearest hospital or to the ambulance services, depending on how critical the situation is. And so these are, I mean, just like a few things or few aspects that make a difference in terms of access when you compare, for example, the UK health services to the African health services. Should we then copy and paste the same model? And the answer is a big no. We need to think about what are our own challenges that we currently face. And I think in maternal health care, there is the framework or the concept of the 3 delay model that is responsible for maternal death. So there is the delay in making the decision to go to the health facility, and things around the education of the woman and all of the like. We need to think about what kind of solutions can we implement to enable people make faster decisions in order to go to the health facility. Do we need to set up insurance? Do we need more education of the women? The second one is delay in actually arriving at the level of the hospital. So it could be roads that is the problem. You can implement an ambulance service in Africa or in Cameroon, for example, when the roads are not in very good conditions, right? So in the UK, there is a clear path. When there is traffic, the ambulance has a path in which it goes through, and it can reach the health facility. In our country, there is the blockage of different cars. The roads are not very accessible. And so sometimes the ambulance may also be stuck in the same traffic. So is ambulance the solution? Certainly not. Probably we need better routes for women to access that. It's not a technology solution, just better routes that we need in order to access that. And the last thing in the 3 delays model is actually delay in accessing care at the level of the facility. Sometimes the healthcare workers are just overwhelmed with a lot of work. So do we need to deploy more human resource? Do we need to deploy better resources in terms of the equipment that are being used at the level of the hospital for these women to get access to better care? But most importantly is, if in the cultural aspect, traditional birth attendants are necessary, how can we collaborate and strengthen them and better equip them to be able to cater for these women? So our African problems need African solutions. We can, and we have the opportunity to leapfrog at this moment, because we can learn from the mistakes of the Western world, how they did implement their solutions. And with technology, we just try to accelerate our own path or find what are the better ways in which we can be able to improve that.
I could not have said that better. Absolutely. Absolutely agree. You said, you really hit it on the head. The way I think of it is the outcome is the same, 0 preventable maternal deaths. But the way to get there, it's going to vary. It has to be personalized depending on the specific region, the specific country, because there are so many different levers, factors at play, and one overarching brush is not going to work. And I think this is probably the proof that we can see today, because I think that has been tried, saying, oh, let's improve this. And now we can learn from those lessons, right? We're trying to implement things that have worked in other places in a different region, and it just may not be the case. And I also believe that sometimes the solution can be easier than we think. For some, maybe, yes, it is getting to the hospital. But what if it's actually a low risk that there is actually a birth attendant who can be there? But as you said, with that additional training, they can identify complications quicker. They know exactly what to do. They maybe have some training even in advanced life support in obstetrics, things like that can help mitigate potential deaths and complications. So I completely agree. Completely. Okay, let's keep it going. I want us to discuss just 2 more levers, and then we will go from there. Actually, 3. So now let's get into your specialty, right? Let's talk about artificial intelligence. We are in 2025. It's like you can't talk about anything without AI. And so, what are your thoughts on AI in healthcare? There's healthcare AI, and then specifically when it comes to maternal health, do you envision a world in which, I mean, we've talked about just now, like personalizing this to different countries. But if we look broadly speaking at women who are maybe in areas which are not as accessible, what are some thoughts that come to mind on how AI can help us deliver better care?
Yeah, so yes, artificial intelligence is here. It's come to stay. It's disrupting the way people access information at the moment. So I remember a few days ago, I was discussing with my father-in-law, and he was showing me the results of an exam. And before, he was the one telling me the reference values of the exams. That I actually checked this online, and it showed the reference was this, that, and was doubting, like, why did they put a particular treatment, give particular treatment to someone, and all of the like. So artificial intelligence is here. It's come to stay. It's disrupting everything that we are seeing at the moment. But I think one of the greatest fear is the inequities that it's going to create, particularly in areas where the models are trained based on using different data, and then we are trying to implement that model in another area. And also inequities in terms of, like I mentioned, the basic things. Artificial intelligence will only work where there is internet access. If you go to a rural area and there is no internet access for the nurse, the midwife, the doctor that is there, it's useless. In fact, it's actually an enabler. It's not a solution. It's an enabler to better care. So basic things like I mentioned, if we go back to the framework, internet access, digital public infrastructure. If you need to train your own models to better perform in your own setting, you need data centers in order to train these models. Another very important aspect, another very important challenge is that in Africa and Cameroon in particular, it's not the absence of data that is the problem. It's how do we get that data into a digital format? The data is there, paper-based data, because what is artificial intelligence is basically garbage in, garbage out. So what you have trained it with, that is what it's going to give you. So in healthcare, if we must adapt solutions or use artificial intelligence for solutions that are within our African context or within our own context, then it means that the model needs to be trained based on locally available data for it to perform better in that light. So, and for that to happen, it basically means that how do we transform the paper-based data into electronic records that can be then used to train a particular model in terms of a particular model to help improve access to care. So otherwise, artificial intelligence is very good. There are several startups that are doing some marvelous work in Africa using artificial intelligence, some symptom tracker, others in maternal health care where they have leveraged even WhatsApp, developed an AI chatbot. Just people can ask questions there and then get responses in that light. But all of this thrive only when there is the basic infrastructure that is needed in order to be able to improve that. If the basic infrastructure is set up, if we have the data centers, if we have the data that is being transformed from the paper records into the digital records, the models being trained, then there is nothing that is stopping us from deploying and making use of the potentials of artificial intelligence.
That's really good. So it's really that I love how you broke it down. Data in, data out is the not the summary of what AI is about. And it's amazing to see how things have evolved. You know, when I was at McKinsey a couple of years ago, we were doing machine learning projects, we were doing these things, but not knowing how they would really help inform what we're seeing today. So I just think it's so interesting. And it helped us, the projects we would work on would help us just help systems get more efficient. But that's such a practical observation. You know, the data is available. It's not an absence of it. It's the fact that it's paper based, but this is now a digital solution. So if we can bridge that gap, which I think is doable, then I think we can get there. But as you said, it's like the foundation. It needs that foundational set, the foundation set first, the internet access, the collection of the data. Is it that we completely stop doing paper records? People have to be comfortable with that too. And then we make the transition. But okay, okay. Thanks for your input. And then let's talk about nutrition. So, for this one, we can actually even focus on Sub-Saharan Africa. One of the supplements I use a lot at RopheMD with my patients is moringa. I find that it has a tremendous array of benefits for women who are pregnant, women who are postpartum. It helps with preventing or reversing anemia. It helps postpartum with increasing breast milk supply. And so I'm just curious to know, of course, this is a tech-based conversation, but nutrition is a huge part of what we do. What are your thoughts? Based on your experience, is there any way that we can use technology to optimize nutrition for pregnant and postpartum women?
Yeah, definitely. I think that it's very possible. I remember while we were implementing Gifted Mom, it's one of the things that we're trying to do. In fact, when we did Gifted Mom, there were several things that we even tried to do. We tried an SMS chatbot, we tried a messenger chatbot, we tried even a WhatsApp chatbot at the time when artificial intelligence was not even very pronounced. And all was in a bid to how do we automate these processes based on the customer needs, and how do we make our work much more efficient and the solution more accessible to people. So definitely when it comes to the nutrition aspect, of course, technology can always be leveraged. In fact, it's an enabler in terms of the first thing is that it can help to better customize, what is the nutrition plan of a particular woman. The second thing it can do, it can provide education, for example, on what a woman may consider. Another thing that it could do, another solution could be that it could check, what are the calories, what are the needs of a particular woman. Based on that, it could use your blood test, like what we're doing at Healthlane, where we take your blood test. We used an algorithm to determine if it was within the range or above the range, and what was the personalized solution that you needed to implement nutrition in terms of nutrition for that aspect. So we were trying as much as possible to disrupt that. And again, the difficulty and when you compare it to the Western world is that a lot of their processes are already well organized, right? So for every food that someone eats, they already know the amount of calories. If you go to a restaurant and you open the menu, they're going to tell you this bowl of rice is about, say, 300 kilocalories or so, or this burger is about these calories. So if you take a solution that is, for example, wanting to know even the calories, and you just snap the burger, it's going to tell you the number of calories. But if you come to the Cameroonian context and you snap Aero, for example, and fufu, maybe the model will not recognize it. It may give you a very wrong result. And that is the same thing like I mentioned in terms of artificial intelligence. What has it been trained on? if it's been trained on the other data, then it cannot recognize some of the foods that we have here. So for it to work in terms of personalized nutrition plan, I mean, it can be at two levels, at the level of the patients and at the level of the healthcare professionals. At the level of the patients is basically chatbots in terms of personalized plan. And chatbots could be today, what should I take based on my current state? And it provides you like different things that you should take. If you put it today on artificial intelligence, it may give you some data related to African context, for example, but it may not give you that personalized data because the model is not trained in the light of the data that we have here in Africa or here in Cameroon, particularly. But chatbots, for example, are one aspect that patients, consumers could use in order to be able to access better information and make better decisions about their nutrition. For healthcare professionals, if, for example, we had electronic health records in health facilities, based on the woman's records, we could have a model that could suggest like what the woman's nutrition plan should be, right? It could enhance the decision-making of the healthcare professionals. For example, if a woman comes and has let's say low iron levels or hemoglobin levels, it could, based on that, flag that this woman has low hemoglobin and probably recommend this particular nutrition plan for the woman. Maybe eat more vegetables or this kind of vegetables, because sometimes just tell the woman eat more vegetables, and especially looking at the financial constraints, it's always like, how do I start doing that? But if we must personalize those solutions, then we must be able to train our own models when it comes to artificial intelligence that can be able to help people get personalized plans for their nutrition. But I can say affirmatively that digital technologies, artificial intelligence can definitely be used to strengthen nutritional plans and the nutrition of different individuals.
Thank you. Yes, that I completely agree with everything. And one thought that came to mind as you were speaking was it's interesting because we're using Cameroon or even Sub-Saharan Africa in this case as an example, but these things we're discussing are actually very much the same issues I'm having even caring for patients in the US. So talking about moringa, these are American issues that I'm discussing. It's not only reserved to like Sub-Saharan Africa or to Cameroon. So I think it really goes to show that this is a global problem, but also a potential global solution. The need for personalization and care is so important. And the part about the regional foods, the local foods is so important. I think by God's grace, I have so much success with my patients because I like to ask them, what are your favorite foods? If we need to change dietary recommendations, what are your favorite foods? For example, if someone's favorite food is eru, and now I'm telling them to go eat broccoli every day. One, maybe they've had it before, maybe not. And even if do they even like it? Right. So if the person does not like it, the chances of them sticking with it are significantly low. And I think that's just the practicality of what we need to consider as healthcare providers as well as we care for patients. So it's interesting to see how this can be implemented on the patient level and also on the provider level. Now, my last question based on our pillars is about the mother experience. As healthcare providers, we can talk about the science, we can talk about the birth process and the hospital, all of that. But what about the individual, right? How can we leverage technology to make sure that as mothers are going through this experience, whether they're pregnant or postpartum, we're making sure that they are able to stay aligned to their values? It could be faith, it could be family, it could even be culture. As we talked about, some women are just not comfortable with the idea of having a male obstetric provider. In your experience, what are some things we can do to just improve satisfaction, emotional well-being, and also that personal or family engagement?
Yeah, so Um, being a global digital health innovator, I mean, just learning from Sub-Saharan Africa, and also I've done my studies in the United Kingdom, and also learning about some of the experiences in the US. I think it gives me the opportunity to be able to compare and contrast service delivery, both at the level of the Western world and Sub-Saharan Africa. Of course, at all of these levels, I must admit that there are they have their different challenges, right? I remember some people complaining about the care in the United Kingdom. I'm like, oh yeah, come to Cameroon and see whether you will complain, right? And I'm like, I mean, you are here in the 5-star and you're complaining. Come and see. So why am I bringing this as a baseline is that there is a cultural aspect and the way systems have been created that mandates for service to be delivered in an excellent way. And that's the Western culture. In the African culture, we are not trained to be very emotional towards patients, for example, or towards people when serving them. Many times we always say the customer is the king, but at the end of the day, the person we're serving looks like the king because they determine whether you live or you die. And so it's more about them versus you. So there is that empathy part that I must say is sometimes lacking in the healthcare system. And people are coming to work very angry, I don't know, tormented by their husbands or their children. They are angry about the bad roads, the bad governance. They're angry about so many things, and the people that they can transmit that anger on are the patients or the people that are before them. And those in the Western world may not have this problem. They may have their own problems, but in Sub-Saharan Africa, it's a whole different ball game because people, the problems that we have are different from the problems that other people have. And so a lot of things determine how people are going to deliver services at the level of the hospital, or at the level of the hospital, at the level of the healthcare facility. And if we must consider the women's emotional health in all of these things, then this is the first thing that we need to consider. The people who deliver the care, what's their culture? Are they being trained to deliver compassionate care? Are they being trained to deliver empathetic care? I must tell you that the training medical school here in Cameroon is different from the training abroad. I studied in the two systems, and you need to be resilient to survive here in Cameroon through the educational system. But abroad, in fact, during my studies, some students were complaining how, oh, they have not been given enough time, they don't have enough resources. I'm like, this is luxury for me. Come on. I had all of the resources, and people are here complaining. I say, oh yeah, come to Cameroon and see how they do education. Then you will be thanking God that, okay, you have everything is fine. I'll no more complain. So again, that is their context and our context. So in essence, I'm saying that those who deliver the service, are they trained to deliver that? The doctors in abroad have a way in which they're probably trained in order to deliver the service. They know that if they don't deliver the service, it plays maybe on their rebates, it plays maybe on their commission, it plays maybe on the hospital's image, because you can be sued. The hospital can be sued. But in Cameroon, whom will you sue? Where will you take your problem to? And so anybody can do anything and go scot-free. There is no level of accountability, if I may put it that way. So first pillar, those delivering the service, are they trained in order to deliver the right customer or the patient care or emotional care to these patients? The second thing is, are the women given the opportunities to give feedbacks Of course, if you go to the different hospitals, you see suggestion box in papers, suggestion boxes, but there are no papers, there are no pens there, and there's no, how do we expect people to put in suggestions, right? But there was something that we did. I remember a project that we carried out in one reference hospital in Cameroon, and the director of the hospital was concerned about the customer service, and he wanted to get feedback from the customers. So we came with our solution. There we're still serving the patients, also sending them SMS reminder. So at the end of every visit, we sent a form to the patients and they filled in information. And there was a particular box in the hospital. I remember very well, they call it box 2, where every patient complained about that box 2. It looks like everybody in that box was rude and all the like. But having that information and sharing with the director changed a lot in the hospital in how people approach care. So what's the point I'm trying to bring out here? Are women given the opportunity to be able to express themselves? So it could be as simple as this SMS solution. It could be as simple as a little survey that is being sent. It could be as simple as a Google review that is being carried out to track the patient's experiences. It could be as simple as when you go to the airport, the 5-scale Likert thesis that asks how was your experience today, with red being very bad and the green being excellent, just pressing that and then just finding out more information about it. It could be about having customer care people at the level, employed at the level of the hospitals to gather information from these women on how their experiences are. But the most important thing of all of this is, how do we act on the feedback of the women? How do we act on the feedback, not just collecting the data and sitting on it? How do we act and ensure that those that offer the good care are being rewarded for it, those that offer bad care are being accountable for their actions, in order that these can better improve? So otherwise, these are the different aspects to consider in terms of the maternal experience index, or different ways in which you can be able to capture that information to help improve the emotional well-being of women when they get to the facilities.
Thank you. That was so comprehensive. I really appreciate, the different recommendations you made, and even the practical example. The leader of the director, he took action, and I believe that's why there were results that were seen. So as you said, that really is the most important part of it, acting on the feedback that is received. So thank you for that. So I want to be very mindful of your time. This has been an extremely rich and insightful conversation, but I don't want to keep you here all day. So tell us, people who desire to connect with you, who want to work with you and want to even know more about Beacon Pasteur, tell us a bit more about how they can work with you and how they can connect with you, please.
Yeah, so I think one of the easiest ways at the moment to connect with me is through LinkedIn. So if you go on LinkedIn, you can find me, Agbor Ashu, MD. So if
Sorry, you're muted, please. It looks like you're muted, please. Hello.
Hello, Larissa, can you hear me?
Okay. Yes, I can hear you. Yep, we're back.
Yeah. Okay, yeah. So I did mention that the easiest way to connect with me at the moment is through LinkedIn. So I'm very much available on LinkedIn. Agbor Ashu, MD. You send me a connection request and leave me a message. I'm always very proactive to respond and look at what are the different ways in which can be able to collaborate on that. But for healthcare practitioners who are in Cameroon, and particularly those that are in Douala, for the diagnostic center that we run in Douala, which is the first that we are starting with. I mean, it's a digitally enabled diagnostic center. We designed our own laboratory information system, designed a platform also where patients could access their results through their smartphones, but also a platform where doctors who want to refer patients to us can just put in the information there. And once the results are available, they have information on that platform. And most importantly, a diagnostic center that is open 24/7 in Douala. So medical doctors that are in Douala, we are very much open to receiving any laboratory diagnostic tests that you want for your patients, as well as imaging, ultrasound, X-ray, radiology. We are very much open to collaborating with you. Please reach out to me even via LinkedIn. And if we cannot connect there, I think you can connect to Larissa, who is here also, and Larissa can put both of us in touch. And again, absolutely, projects that involve digital transformation, I'm your guy in terms of consultancies, and I think based on the experiences and the education that I've had, I can be able to provide support at that level. So yeah, I'm very much open to collaborations and open to working with people.
Amazing. Thank you. And so you are able to do, just to clarify, you also do interpretation of the ultrasounds, the x-rays, etc.
Yeah, obviously.
Perfect.
We work with the radiologists,
Perfect.
radiology scientists who can all definitely always interpret those results for you.
Okay, great. And I really love that you said it's 24/7. So that is definitely an incredible value add. So thank you, thank you, thank you, Dr. Ashu. This has been amazing. We thank God for your life. We thank God for all the amazing things which you have been doing. Clearly, you have a very long track record in this field. You have been creating impact really from right after you completed your training. You hit the ground and you've been running ever since, and it's been really incredible to see how the journey has progressed thus far, and I'm sure there's only more to come from you. So thank you for being an asset. Thank you for being a great colleague. Thank you for all the education you're also doing, and now even being able to offer consultancy to other providers who might need it. So thank you for your time. Any final words? No. All right. I think we are at time. Thank you. Thank you. Thank you. Thank you. Okay. Bye.